Hello, my name is Erica Jeffrey. My number is 1014318. I am going to do my best here with my limited space and limited supplies to show you how to do a sterile dressing change with surgical removal and sterile strip application. First thing that I would do is to note what type of dressing and what sutures need to be removed beforehand. I'm going to look at the doctor's orders and see that changing dressing to abdominal incision daily. And it also says that to remove every second staple and apply sterile strips. I'm also noting that the patient's name and birth date. So when I go in, I'm going to introduce myself to the patient. Hello, my name is Erica. I'm going to be your nurse. I'm going to make sure I do hand hygiene before I went in, providing privacy as well. I'm going to ask them what their two identifiers are, name and their birthday. I'm going to explain the procedure to them and let them know that I'm going to be changing their dressing today and removing some staples and applying sterile strips. I'm then going to make sure that my patient is in, say, a supine position, comfortable, and exposing the dressing area. I then would make sure that I already gathered my supplies when I went to go introduce myself as well, after I saw the doctor's orders. And I'm going to apply clean gloves. So I've been putting these on and off, so hopefully they slide on. After I did some hand hygiene, put the clean gloves on, and I'm going to remove the old dressing and assess for any drainage. And so what I'm going to do is pretend this is my patient. Okay, and this is their, obviously I'm not going to touch them like that. This is their dressing, okay, for their abdominal area. I would be using my clean hand, and I will be removing the top layer and discard in a biohazard bag, and one layer at a time. And if I'm doing this one here, I'm gonna make sure that anything that's in here, drainage, would be folded inside when disposing of it. Obviously, I'd be a little bit more gentle if it was a human being, not a stuffy. I'm also then going to remove my dirty gloves and wash my hands. Okay, I'm going to then discard these, discard that, do some hand hygiene, put new gloves on, and I'm going to inspect the wound. I'm going to palpate. So I'm going to lightly touch to see if any redness. I'm not going to touch the wound either. I'm just going to see if there's any tenderness or if there's any bulges. I'm going to see if there's any redness, if there's signs of infection. I'm then going to set up a sterile dressing tray so I can clean. I want to clean it. So this is a minor dressing tray. Pretend that it was never opened, okay? So we're going to open like a banana peel. Open it up. And see, it's hard to reuse these kind of things for this video. I'm going to peel from the outside in. Say there's forceps here, so I'll be using those. And opening it as so. And this is a sterile peel. And I'm not going to use this, like pretend this is like laid flat, okay? There's a border for the sterile part of it. Do not place these, so I have this on the side. Then with my clean hand, I would take this off as well, put it by my patient. I'm going to pretend that this is saline, okay? And I will be putting it in the tray, just pretend it's there. There's going to be force clips in here, and when I'm cleaning the wound, pretend this is it, okay? I will do one swipe, like this, and discard. And also I'll do another one. Dip in the solution, one swipe, and discard. You discard each time that you're swiping, and it's going to be from the cleanliness to the dirtiest, okay? Then afterwards, I'm going to let that dry, and I'm going to blot it to dry. So with the other forceps, without being wet, I would lightly just go and make sure that it was dry around the sutures. Okay, so then we're going to just I'm going to open after this is drying and stuff, I'm going to open the suture removal kit. So pretending this is the sterile field here, I would grab, say this is the staple removers and just toss it onto the sterile field, as well as everything I need. You're just going to open it up and discard on the sterile field. So, and I think, and I had tweezers as well. Okay, and my tweezers. And they just unfold and they fall onto the sterile field in real life. Okay, so I'm going to remove the sutures as it says on the doctor's orders. So with the suture removal kit, so I'm going to show you, I don't know if you can see this. So with the clean hand, okay, I would pretend this is attached to somebody, but it comes over here like this, and it does the work for you. You just push, and then you're going to discard it on, say, a little piece of gauze. If the gauze was, yeah, so you just, on here, and it does it for you, and it removes. And in the doctor's order, it was every other one, but so we don't do that. Now for scissors, I don't have scissors on me, but say if we're removing these sutures here, you pick out right here, and I would be cutting it where that little knot is, and then the tweezers would pull it out. So you don't want to infect and pull it through, if that explains that. Put that back on the patient here. Yeah, and then we would always discard of this, if so. For applying the stereo strips, you open it like a banana peel. We can remove this part right here, so it makes it easier to remove. It'll be the top right there, if I can show you. And when you can, say you can use this end of, say, the tweezers, and you go like this, and you're just going to place it on lightly on one side, right there. And you don't want to pull or tug or anything because it can tear the skin. And yeah, other techniques is with the fingers, and you just remove it, just put it down on there softly. It's nice and smooth. It's supposed to be about 3/4 on each side, but whatever the protocol is for the hospital. So after applying the stereo strips, I would cover up the patient as doing so, as I would with the proper dressings as the doctor would have ordered. So again, and we'll do like, see this, little tape, another layer, and say since it's on the abdominal, we're using a abdominal pad. The biggest pad will go on top. I remove my gloves, I would wash my hands, and I will go back to evaluate and document the procedure. Thank you.